Thank you all ahead of time for coming out. So my goal tonight is to try to teach everybody, probably more than they ever wanted to know about stress, anxiety, but really more importantly about how it affects your body and then practical things that you can do to improve that. I just want to start by thanking the Cancer Institute at Stanford for inviting me over to give the talk. I'm very grateful. All right, so learning objectives, that's our fancy way of saying, what am I hoping to convey? So I just want to start out, first we'll talk a little bit about what stressors are, and they're different for everybody, so we'll talk a little bit about that. And then we'll define stress, so basically what do the scientists say it is? And I want to go through also some mechanisms of stress, and that's really, how does that affect me? So if you're thinking about what is this doing to me? And then we'll talk a little bit about pathophysiology. That is just a scientific way of saying, how can it hurt me? So what's the stress doing to me? And then a little bit about when stress becomes anxiety. And then we'll hit the fun part, which is really the management techniques. And then I'm happy to take any questions at the end. So what is stress? And this is where I want to start. I do these 6-week visits for patients. Because what I found in my practice is that I kept seeing people coming in over and over and over who were presenting with lots of stress and anxiety. I started researching this area about, our daughter is 20, so I started about 30 years ago. And back then we used to say stress was really bad for you, but we didn't have a really good idea of why or how it was. And one of the things that we've learned over the 20 years is what are stressors. So we're a small group, so I want to have people shout out to me, and I'm going to put it up on this board to just help illustrate just the variety. So I'm going to throw my first one out there, if that's okay. Mine is work. So my stress is my work, and sometimes when there's a lot of doctors out on vacation, the load is really heavy. So how about throw some other ones? I'm sorry? Arguing, so like fighting, arguing. What else? Uncertainty, love that. Yeah, there's a lot of that. Good, what else? Change, huge. Good, what else?
Relationships.
Yes, big one. Good. What else?
Finances.
Throw them out. Throw them out.
Finances.
Finances. Money. Okay. Relationships. What else?
Illness.
I'm sorry?
Illness.
Illness. Absolutely. Good. What else? What makes you angst? Food. Good. What else?
Traffic.
Yes, that's always one that comes up. You know, I've got people commuting 2 hours, right? 1 hour out, 1 hour back. I've got people commuting an hour and a half. I've got people who I'm trying to do as much as I can with them going to an outside lab and calling them on the phone so they don't have to come in because they've got that terrible commute. Good. What else? Couple more. Big ones. What makes you, I'll throw a couple. Loss is a really big one. So loss is really, really big. And then, and the other one is move. So just move location, moving houses, moving jobs. So transition is another way to do that. So there's this, as we've studied this, as I said over the years, what we have found is that there are major stressors in life that can cause a lot of problems. And those tend to be relationship, loss, work, major, move or change. I'll put these equals this, right? Move or change, and illness. 1, 2, 3, 4, 5. Those are the 5 major sources of stress in people's lives. So one of the things that I like to start out, the reason that I say that that's helpful to do that is it's different for different people. So for some people, traffic is just terrible. Being in the car is terrible. But I've actually got patients who say, hey, I put an audio book on in the car, or I listen to music in the car, and it's my time to transition from this really stressful work, all day to, I kind of get to unwind a little bit and relax. And so one person's stressor isn't necessarily another person's stressors. But I'm with you, whoever said traffic, that definitely, I'm with you there. Okay, so that's what we all consider as stress, but what do the experts say? So stress was defined, started to be popularized about 50 years ago when I was studying this. 30 years ago, this guy was my hero, Hans Selye. So he started to look at stress, and he did it in animal models. And it was kind of, we do terrible things to medical students and to animals when we're studying them. He would put rodents in a cold water bath and not let them get out. They didn't have steps to get out. So they would be swimming around and induce this stress. And he defined stress as a non-specific response, okay, to any pressure or demand. So stress doesn't have to be my way. It doesn't have to be your way. It's any way. It's any response that puts pressure, that causes this to any, it's any non-specific response to any pressure or demand. Now, the thing that I really loved even back then was that he really appreciated that it was the total response of the organism. It's not just my stomach hurts. It's not just that I get a headache. It's not just that I can't sleep. It's the whole response, the mind and the body. And I always so appreciated that he took both of those things into consideration. I think as doctors, sometimes one of our problems is somebody comes in, they say my stomach hurts, and we go right for the stomach. And we're asking about what did you eat, and what are you drinking, what are you eating, how long has it been since you ate? But we don't ask about other things, right? We don't consider the whole organism. But Selye did. He said, no, it's the mind and the body's response to these pressures or demands. And all of these things, I think you guys can agree, are pressures or demands in some ways on our life. Okay, so that's what Selye said was stress. And stressors, I loved also, that he really appreciated. It could be an internal thought or it can be an external event. So here, these are kind of all external things, right? Well, relationships, typically that's more still external. But really, a stress can just be an internal thought. Right? Oh, I really don't want to do this. It's Monday. Do I have to get up and go to work? I really don't want to go to work. So that can be an internal stressor. It's nothing outside. Nothing's bringing it in. There's no traffic. I'm not having to pay my bills or anything. It's just me. It's me inside of me. So stress does not need to be something that's outside of us. It could be an internal thought. And the coolest thing, this is what I was trying to get at how these are so different for everybody, is I think to understand that it's our individual perception of the stressor that makes it a stress. So I threw that analogy out, right? I said, for some people, traffic is terrible. But for other people, it's their time to transition and they really enjoy just sitting in the car for 30 minutes. I've had moms tell me, I get to the house and I park and I wait 5 minutes before I go in. And I just take a breath and I just sit in my parked car and I wait 5 minutes because I just need that me time. So for them, that transition, that 30-minute, maybe not an hour and a half traffic, but maybe 30-minute traffic is some time for them to just unwind. So it's our individual perception that makes it a negative thing, okay? All right, so stress, anything not specific, but it affects the whole organism. Stressors, anything that we see internally as a negative, okay? All right, so let's move on now to mechanisms of stress. So the way I teach this, when I'm talking to medical students, or I've taught this to I have a group of high school students that come to Stanford for the summer, and I'll do the talk on stress and illness with them. And one of the things that I try to get people to think about is, why do we have this response anyways? Like, how does this serve us? How does being all about traffic or about arguing or about relationships, how does that serve us? Well, it kind of doesn't now, but it's really important to remember or to know that stress initially was a response to a physical stressor. Okay, back hundreds of thousands of years ago, we weren't worrying about traffic, we kind of weren't worrying about money, we were worrying about really basic needs. And I tell people, it's like this this lion is coming after you. It's like you're running away from somebody who has a spear in their hand and is about to steal the rabbit that you just killed for your family. It's at that level. So historically, stress was a physical thing. It was a physical event. It wasn't a psychological. It wasn't something that we were kind of, I don't want to go to work. It wasn't an internal. It was a very external physical response. And we needed to survive that with a physical response as well. Our body had to mount a response that could get us safely away from that lion or that person coming after us with a spear. For us women, we were birthing in fields. We were having babies out in fields or in little huts. There was no epidural. And so that was a big physical stressor, right? And we had to mount the physical response to survive that event. So if you think about it that way, lots of times I'll tell my patients, I'll say, well, why do I have a panic attack when I'm about to get on the freeway? And I'm like, well, the response isn't really about the freeway. The response really to your brain now is the same response that we had hundreds of thousands of years ago. That lion's coming after me. So it helps you to understand why you have the response. That part in our brain got embedded. It helped us to survive. And so now hundreds of thousands of years, we still have that same mechanism. And it's very powerful. It's actually, it's a really cool mechanism, as I'll show you. Okay, so let's break it down a little bit more. So now we know it was a physical. Before, stress were physical, and the response was basically we needed to survive a physical attack. Now, if we break it down, there's actually two mechanisms to this even further. We break it down a little bit more. The first initial response is really immediate. I tell people you have absolutely no control over this first immediate response. So this is the kind of thing where you don't think about it. It's immediate, literally like even, you can't even time it as a second. It's like nanoseconds. It's like, poof, it just happens. It's unconscious. And the hormones that are released during this episode are two hormones called epinephrine and norepinephrine. So this response is kind of like this happening to you, okay? Now, this poor kid did not see this horse, or I think that's a donkey. I think that's a little burro coming in through the window, right? That looks like a little burro to me. Now, look at this poor kid. He had no time to process this whatsoever, right? I mean, that donkey came through the window and he just has this massive response. Now look really close at him and you tell me, what do you see? Let's start from the eyes. What do you see happening to his eyes? Wider, right? Okay, what's happening to his muscles in his face? Clenched, they're contracting, good. What do you think is happening to his breathing? Rapid, right, one of two. It's either rapid or he's just like, and just kind of stopped, right? So that's his breathing. What do you think's happening to his heart? It is just like going, right? Maybe 100, 110. If he's really scared, 120 beats a minute. And then what about the muscles in the rest of his body? What do you think is going on there? Tense, absolutely tense. Now, if you think about the lion analogy, okay, he activated that same mechanism that in hundreds of thousands of years ago, he was meant to run away from that physical threat. But he can't. Now he's sitting in a car, probably with the seatbelt on, and he just can't. But his physical response is still going to be the same. He's still going to secrete those same hormones, and he's still going to have the same physical response that we would have had hundreds of thousands of years ago with the lion. okay? Do you see now why it's kind of like, ooh, that's not such a good thing, right? This first immediate response is through a sympathetic nervous system. So as you'll see up on, it's pretty much what you guys nailed. So you talked about the eyes opening up, so the pupils dilate. And the reason that the pupils dilate is because you want to be able to scan and see where is the physical threat coming from? Where is the danger coming from? I need to see it. I need to plan, how am I going to get away from it? So your pupils are going to dilate so you can get more visual input. So it inhibits your salivation. That kind of goes with the stomach a little bit lower. We were not meant to be digesting food as we're running away from the lion. Right? That's not a time that our stomach is going to go, hey, let's digest food. No, no, no. We need to be able to have immediate energy, but we're not going to digest food. Our salivary glands will be inhibited initially. We talked about the breathing. That's the relaxes the bronchial airways. So the airways will just, they'll just kind of relax so you can take a deeper breath, so you can get more oxygen to the brain, to the heart, to the muscles. Okay, so the bronchial airways will relax. The heart rate will accelerate, so faster heartbeat. And then again, down at the stomach, that's the stomach. That middle kind of curvy thing here is the stomach. So it inhibits squeezing, peristalsis of the stomach, so we're not going to digest. And it inhibits initially some of the secretion of the digestive enzymes. So that's why some people will get like heartburn. They like, if you eat really fast, or you eat and you're really stressed, or you eat and it's a bad meeting with your boss, that's why sometimes people will have some abdominal pain. We weren't meant to be eating in those conditions. Interestingly enough, the epinephrine and the norepinephrine will cause us to make more glucose. So what does that mean? That means our body releases more of a type of a sugar, and so we have more energy. Again, what are we trying to feed? The muscles, the heart, the lungs. We're trying to run away from that lion. We need energy. And then we talked already about the secretion of the adrenaline and the noradrenaline. It inhibits bladder contraction, and so some people will have some difficulty, they won't urinate. It's interesting, some people have said to me, yeah, but I'm really nervous and I have to urinate more frequently. And I'm like, yeah, that's still, that happens a lot, but it's not generally these two hormones. And then lastly, it can stimulate orgasm. That's a different talk that I haven't been asked to do. All right, so that's the sympathetic nervous system. Okay, so I talked about, said that there were two, that's the immediate one. And the second one, interestingly, is also, this one is delayed. So whereas the other one is like instantaneous, our secondary response to a stressor is delayed. It could be minutes to hours later to weeks, unfortunately to years. My friends and I, when we were in medical school, we used to joke and say that, we were sure we were in a hypercortisol state because medical school was just so grueling. And then we got to residency and we laughed about medical school. And we're like, yeah, that was nothing. So it could be delayed. It's also unconscious. It's secreted naturally. It's part of that same brain mechanism. The hormone that's released is cortisol. So what do you think this stress is like? If the first one is like that immediate one, what do you think this stress is like? Any ideas?
Getting sick.
Good, yeah. Getting really sick, yep. What else? Any other thoughts?
Like a block of your brain.
I'm sorry?
Like almost like a block, you're trying to dismiss things.
Yeah, actually that's a great point just in terms of response of this type of stress, for sure. But the other things are really all of this, right? So all of this are not like the lion's coming after me initially, or tends not to be kind of like, that donkey's coming through the window. These types of stressors tend to be much more prolonged, slower onset, longer onset, and so they tend to turn more of this response on. So it's more like the work, right? I love this picture because she's got a calendar on one side, she's got her laptop on the other, and then she's got a writing pad. And it makes me think sometimes of multitasking and what I'm trying to do. My daughter will say to me, do you want me to write you a to-do list, Mom? Do you want me to write you your to-do list? And I'm like, no, get out of my head. Don't do my to-do list for me. But this is a lot of us when we're trying to get a lot of stuff done, right? You're multitasking. It's something like this. right? We talked about relationships. And this is certainly looks like there's some conflict with relationships. It doesn't have to be a romantic relationship. It could be a relationship with a parent, a sibling, kids. How many have teenage kids? I don't want to pick on teenage kids, but ours is now 20, so we've kind of gotten over the hump. But we can remember, and yeah, we're a little over that. We're a little over that high school hump. So different types of relationships. It doesn't necessarily need to be romantic. And then one of the things that we didn't put up here that I think is really important for people to realize is a relationship of caregiving. So caregivers are can be some of the most stress relationships. It's really difficult to be a caregiver, and it can be a caregiver of a child. It can be a caregiver of a parent, of a sibling. But it really, as we study stress, caregiving is definitely one of the most taxing. Burnout is really high. And one of the things that we're trying to do is be mindful of people when they come in the office. And if the adult children of one of my patients comes in and they've brought in their parent, one of my questions is definitely to the adult child, hey, how are you doing? What's your release? How are you managing the stress? Because it's very stressful. All right, so this second mechanism we've talked about, it's more like these stressors. How does it work? So the first one I showed you that diagram. So this response is called the hypothalamic pituitaryadrenal axis response. So fancy word for basically saying the brain in this area called the hypothalamus secretes a hormone, corticotropin releasing factor, which is that CRF hormone, and then that stimulates the pituitary. The pituitary gland is actually the mother of all hormone glands in the brain, and it's literally right behind your eye. If you were to go straight back, about a finger's depth back, straight back, is your pituitary gland. Really small gland, and sometimes when they need to go in to do surgery, they'll actually go up through the nasal passages. It's kind of cool because it hits it right there. But it's a very potent gland, central hormone gland in the brain. The pituitary then secretes other hormones, the adrenocorticotropin hormone, that's at ACTH. And these little guys on the side are kidneys. But it's hard to see, but if you see these little things up on top, those are the adrenal glands. And the adrenal glands is the home of cortisol. So it's this whole cascade that causes final release of this secondary cortisol hormone. And then you start to get this stress response. So what does cortisol do? Well, like adrenaline and noradrenaline, cortisol tends to do a lot of the similar things. So it'll keep your heart rate and your blood pressure elevated. It helps to secrete glucose in the blood. Prednisone, I don't know if you guys have ever heard, prednisone is a type of glucocorticoid, and people who are on prednisone, their sugar tends to spike. We worry about them becoming diabetics with prolonged use. So cortisol is very potent. It wants to release more sugar so that you have more energy in your body. It will also help to dilate those bronchial airways so you can take a deep breath. Same thing with the digestive activity, it's going to reduce it. Now the cortisol is considered an anabolic steroid, and so what it does is it causes increased energy. It's going to get it from different areas. So one of the areas is it increases fat breakdown. So fat is actually a really good source of energy. And so what cortisol will do when it's released is it will come, and if it's, its job is to produce energy, so it will cause you to break down some fat. Now the bad thing about that is, especially with prolonged cortisol use, is you also start to break down some bone. You get some increase in your bone turnover as well. Now this is my area of particular interest in that cortisol has also been shown to be related to increased inflammation. So what do I mean by inflammation? It's swelling. If you think about when you've cut yourself or when you've been bitten by a spider and you get like really red really fast, those are types of allergic responses, or sorry, not allergy, but inflammation. Allergy is a little bit different. If you think, this actually makes sense. If you think about the lion, right? And you're running and you're out in the woods and you step on something, you want to be able to mount an inflammatory response, right? You want to protect yourself from infection. Now let's take this slower response. Let's say that same analogy, but now you're hunting. And you're going to go out hunting back in the day, and you're going to have to hunt for like 8 or 10 hours. And you're going to, be out there all day long. If you're out the first 2 hours and you step on something, you have to be able to mount an inflammatory response so that you can keep going. That inflammatory response is going to protect you from getting a more serious infection. And so it's going to help you initially. So initially with our stress response, we have increased inflammation, and that's good. And I'm making a point of that because we're going to talk about when good goes bad a little bit later. You also have increased arousal and focus. So whereas the first one, the epinephrine and the norepinephrine, is more like, I got to get out, and that's all you can think about, I got to get out. This one is more, okay, I have to pay attention. Some people say, who are procrastinators in the room? Who are procrastinators? Yes, yes, yes. Okay, so some of the thoughts about procrastination is that it causes this kind of a response in your body. And you're just a little bit more activated and attuned, and that helps with arousal and focus. So cortisol is the hormone that helps with that. And then it's interesting that cortisol is the one that we think is related to putting an emotion to the stress. So, oh wow, this was not a good thing. I don't want to procrastinate on this paper next year or on my next class. So that kind of a thought pattern is more cortisol. Remember that first one, it's all about fight or flight. I got to get out of there. I'm not thinking about if this is good or this is bad or how am I going to take care of this later. Not at all. All right, so the first response, again, we call it fight or flight. It's a sympathetic activation. It's release of epinephrine and norepinephrine, and it causes all those things that you think about if you think about a lion coming after you, okay? The second response is the one we just went through, the hypothalamic pituitary adrenal axis. It's a slower response. It's a glucocorticoid. It releases that cortisol, helps you have some emotion about the stressor, helps you kind of think about it a little bit. So that might be why people procrastinate and feel like they get that job done really well. It's immune activating, and initially that's a good thing. And then it also causes this, we call it a metabolic response, meaning it activates the body to produce more energy. Okay? All right, so that's the mechanism. So that's stress, how stress is defined. We talked about stressors. We talked about mechanisms. There's an immediate mechanism, and then there's a slower mechanism. And then let's talk about when stress goes bad. So there's a lot of things that happen with prolonged stress. So I always tell people one of the things with the immune system is we were never meant to be in a chronic inflammatory state, like always turned on. So in terms of the immune system, with prolonged stress, we see lots of things go on. This first one is a decreased response to vaccines. So who gets their flu vaccine here? I know I do, or I have to wear a mask all year. Good, yeah, so a lot of people. So they did a study where I thought it was kind of cruel but funny too at the same time. They took medical students while they were in exams, and they tried to vaccinate them while they were in exams. They tried to vaccinate them to influenza, to the flu vaccine. And they had a control group of people who were the same gender and age, so age-matched controls. And what they found is if they vaccinated the medical students during a stressful period like their exams, they mounted a significantly lower response to that flu vaccine than just normal age and gender matched controls. So that showed that when we're in a stressful time, we're not able to mount a vaccine response very well. So that's the first thing. It also decreases wound healing. Now, why is that bad? Any thoughts on that? Remember how I was talking about it? Like if you're out hunting and you get a cut on your foot, you don't want the wound healing to be delayed, right? You want to have good wound healing. So wound healing is delayed. The resistance to infection probably goes hand in hand with that wound healing, is also decreased. So you're not able to fight off infection. So not only can you not mount a good immune response to vaccines, you can't fight the infection and you can't heal. You see how that all just starts to add up to problems. Normally, our body is scanning for cancer cells, and there are certain cells that will come and kill them. But what we see in people who are in chronic stressful periods is that they have decreased ability to kill those cancer cells. So apoptosis, we call that, is reduced. So that's what's down in the immune system. What about what's up? So what's up is, I talked about this already, the inflammation. And chronic inflammation, I tell my residents and my medical students this, I tell them, hopefully I won't be so much in the field in 15 years, but I tell them you will. And ultimately, I really believe that the root of all evil is going to be much more around inflammation. So cancer, rheumatological disorders, even coronary artery disease. We used to think it was just the plaque, and now we're seeing that it's the inflammation around the plaque that's really the bad thing. So inflammation, uncontrolled inflammation in the body is really bad. So we have increased inflammation and we have increased rheumatological diseases. A rheumatological disease is like rheumatoid arthritis, lupus, Sjogren's, all these types of diseases. And what's happening there is your body is actually attacking itself. So for some reason, your immune system has gone around, it's surveying, and it goes, oh, that's abnormal, that's foreign, we have to kill it. And that's an autoimmunity. You're attacking yourself. And we're seeing a lot more of that now. And we think a lot of that is due to various conditions, but certainly prolonged stress would do that. Okay, so when stress goes bad in the immune system, how about in the brain? Well, this one is really interesting. Remember how we talked about a little bit of stress for procrastinators can get them through that time, that crunch time. If you prolong that, what we have found is that prolonged stress actually decreases your concentration. So you actually like your ability to sit for an exam or to study for an exam decreases. Your memory decreases, so the amount of information that you're able to retain decreases. And then also, it's really cool. I used to, years ago, my husband and I actually did research, he did much more than I did, in the hippocampus. It's one of the brain regions where memory is very important region for memory. When we look at people, it's really interesting because there have been studies in people who have had significant stress for years. And what they find when they scan them is that that area of their brain has atrophied. It's shrunk. It's gotten smaller. So big changes in terms of brain function with chronic stress. Okay, what about your mood? So with prolonged stress, there's increase, of course, of anxiety and depression. We see that a lot. The one thing that I tell people also is PTSD is directly related to stress, right? I mean, the whole, by definition, people have experienced a traumatic event, a huge stressor, and that condition is directly attributable to a major stress. But also in terms of mood, your sleep is affected. People will have insomnia. So not only can you not fight infection, you can't heal well, you're chronically inflamed, your concentration is poor, your memory is affected, and then now comes your mood. So then your mood is affected. And then what about pain? So interestingly enough, remember how I talked about the lion and you want to get away? You're going to actually, in those first few moments, you're going to feel less pain. Has anybody ever been in a car accident and it's been a big car accident and there's glass and afterwards you go, oh wow, I've got a cut. I didn't feel that cut initially. That's that first response. You don't feel the pain. But people who are in prolonged stress, their pain perception actually increases. So I've had patients who have chronic pain who have come into me and they've said, I really want to try to get off my opiates. But their mood has really been, they've had a lot of anxiety. And I've said to them, we have to control the anxiety first. If we don't get a hold of the anxiety, or sometimes they'll have depression as well, I tell them it's going to be very difficult because as we wean down on the pain medicines, you're going to feel the pain more. And so the first thing that we do is actually work on the mood. Once the mood is nice and stable, then we start backing off on the opiates. Okay, so that's when stress has gone bad. All right. So let's talk a little bit about when stress becomes anxiety. So I tell people the analogy that I use is that there's this long-term stimulation of that brain system, that first one that we talked about, the sympathetic nervous system. And that causes a dysregulation. So what does that mean? And I use this analogy. Okay, there's all these cords here, right? And they all have these plugs. Well, if for some reason this wall got knocked out, right? There's a short in that electrical system. For whatever reason, that wall got knocked out, these electrical wires now have a short. And they're not firing normal, right? If there's a short in an electrical wire, it's not going to run normal. It's not going to run its normal circuit. We think that that's a similar analogy of what happens with prolonged stress. We feel like there's a neural net. We say there's a neural net in the brain. There's a certain firing pattern in the brain. And when people have prolonged or intense stress, and it's probably a combination of both, that neural net, that wiring in the brain gets changed. And now, instead of coming in and plugging this and I get my computer charged, I plug it in and poof, my computer blows up because there's a short in the wall. There's a short in the wiring. So I tell people it's like that. It's like a room in your house had some structural damage to it, and now there's a short in that electrical system. So in brain terms, that neural net, it's been altered. It's not flowing the same kind of normal neural net that we have. And instead of having significant amounts of these stressors come in, now you just have the thought of the stress, and it provokes that response, like the lion's coming after me. Does that make sense? I just have the thought of getting in my car and having to drive on the freeway. And now I have a release of those hormones of the lion coming after me, like I showed in that first slide. So that electrical circuit, that neural net in our brain has been changed with prolonged stress. That's what we think is happening. There's just this change in the way our brain is firing in this system. So when we talk about anxiety, I just wanted to also make sure that we were on the same page with that. So anxiety is considered, and it's an emotion, okay? It's an emotion by feelings of worry and tension. So it's not anymore a response to these things, okay? Oh, I'm sick, I feel bad. Now it's just the feeling without the illness, okay? That's where anxiety. But if you have one of these, what do you think it's going to do to the anxiety? Up. Oh yeah, right? Because we already said there's a short in that electrical wiring. So I'm already having that hormone release. But then you add this stimuli to it, and holy cow, that hormone release is really powerful, okay? So that's anxiety, right? Feelings of worry and tension. So when do you get an anxiety disorder? So you get an anxiety disorder with chronic anxiety. So it's the chronic stressors lead to anxiety. Chronic anxiety leads to anxiety disorders. And those are chronic, and they are really characterized by intrusive thoughts. So I always ask my patients, I see a lot of patients with stress and anxiety, a lot. And I always ask them, I go, and it's funny, I never have to define this. They always know what I'm talking about. I go, are you spinning? Like, are you spinning? And they're like, oh yeah, I'm spinning. And that's that intrusive thought. It's like you just can't stop that thought. It just keeps coming. I'm worried about this, I'm worried about this, I'm worried about, you just cannot stop that thought. It's very intrusive thinking. So the intrusive thoughts, and I tell people it's worry to the point that now it's interfering with your normal life functioning. So now you can't find enjoyment. Okay, so you're not enjoying things as much as you can because you've got these intrusive thoughts, right? You can't get out of that neural net pattern. And it's not specifically related to any single event, right? That's what I said. You don't have to be getting on the car for the freeway. You just think about something and it brings it on. But then you get in the car and you go on the freeway, oh, it's going to bring it on even higher. Okay? So it's just escalating one right after the other, right after the other. So I always say in about this part of the talk that as dire as all that sounds, I just want to bring you to a happy place. because now we're going to change focus. And we talked about sort of stress, why it's good, why it's traveled with us for hundreds of thousands of years, helped us survive, what is stress, how it works, and then when stress goes bad. But now I want to talk more about what you can do to help manage your stress, and we'll spend the next half of the talk with that. So what I want you to do at this point with that beautiful slide up there is just close your eyes. Just close your eyes. And then I want you to just take some really deep breaths. And what I want you to do, in through your nose, and then out. And then just another in through your nose, and then out. And then one last in through your nose, and then out. And then when you're ready, just go ahead and open your eyes. Okay, so how many felt different from my just like talking, right? It does not take very much. So there are a lot of things that you can do to help manage the stress. This is my second favorite part of the talk, because then I get to take some deep breaths as well. When we bring people into the clinic to check their blood pressure, the nurses know we have a protocol. We have people sit. We have them take 5 nice, big, deep breaths. We have them close their eyes and not talk, not say anything, and then we check their blood pressure. Because we know that really that's the beginning of getting yourself out of that neural loop and just, okay, letting the relaxing hormones take place. So let's talk about what can we do. All right, so the first thing I want to talk about is exercise. So exercise is really important. I normally will start here with people. Exercise is particularly helpful if you are very anxious. So if you're finding that your anxiety level is really high, you want to start with exercise. So why do I say that? You're moving. You're kind of feeling like I'm doing something with that extra energy. It's kind of like a release. But the nice part about it is if you exercise, you start to, I tell people, you're releasing happy hormones. And the happy hormones are called endorphins. And my family will attest to my love of my endorphins because I will be really tired and I'll, yes, even be a little grouchy, but oh my goodness, after I go exercise, I just feel so good. And it's because if you do it over time and you're consistent about your exercise, your endorphin release with your exercise gets to be much more predictable. It's like boom, boom, boom. And at first it's going to take you a little while. It's not going to be that first time you work out, might not even be that third time you work out. But slowly you're going to start releasing more endorphins, more endorphins, more endorphins. And that part of the system that the endorphins activate, the nervous system, is actually the relaxing part. It's called the parasympathetic nervous system. I use the analogy, who celebrates Thanksgiving? Okay. Do you know how you feel after you've had a really good Thanksgiving dinner? And you're just like, oh, you're just sitting there and you're full and you're nice and relaxed and you want more, but you're like, I'm going to eat in another 2 hours. And life is really good. That's kind of like an endorphin feeling after exercise. You are just so relaxed. So the hormones that are released when you exercise counter the activating hormones that we talked about, the epinephrine, the norepinephrine, and even the cortisol. So how much do you need to do? I tell people as much as possible. So I tell people start, if you've not exercised at all, you don't have to go to the gym. You just have to put on a pair of tennies and just go outside and walk. If you start, you want to just start 20 to 30 minutes 3 times a week. So try for every other day. And you really have to start at 20, and build up after a couple of weeks to 30 minutes. And start at 3 times a week, but really what you want to do is hit it to 4 times a week. The recommendations, the national recommendations are to exercise 30 to 40 minutes on most days of the week, meaning 5. But we're really busy, and I find that that's really hard for people. So I always tell them, just start with 30 minutes, 20 to 30 minutes, 3 times a week. Now here's the other good news about that. You can actually break that up. So you could do 15 minutes at lunch. If you have stairs, like, I took the elevator. I was looking for the stairwell, but I couldn't find it, so I jumped on the elevator. But if you have stairs, you just walk up and down the stairs for 15 minutes at lunchtime. And then before you get in your car, you walk up and down those stairs again for another 15 minutes. And boom, there's your half an hour. Okay, it counts. You can break it up like that into increments. The other thing that I tell people, as I tell them, never, 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 never walk in your house if you intend to go exercise after work. Don't walk in your house. You pack your bag, you change before you leave work. If you want to park your car in front of your house, that's fine, but do not walk into the house. Because what happens, tell me, what happens when you walk in your house? You sit down, it's a done deal. I don't sit down. I go straight to the kitchen. So I'm like fixing dinner. Okay, what are we going to eat? And I'm getting everything out. And, I'm just, but it won't happen, right? It won't happen. So I tell people, try to plan ahead for your exercise. Think about what days are going to work for you. Think about if you're a morning person. Or an afternoon. My husband and I years ago lived in Berkeley, and I would get up with him at about 5:15 in the morning, and we would ride up the hill to the campus, and we would exercise, and then he would shower and go to the lab from there, and then I would ride my bike down, go home, shower, change, jump on BART to come into the city. And I can't tell you how painful that was. It was so painful. But it felt really good on the way home. Right? It never felt good to me getting out of my nice warm bed to ride the bike in the dark up the hill. But boy, did I feel good on the ride home, and actually really set the rest of the day. If you exercise in the evening, it's super wonderful because you'll also sleep well. But I tell people, if you exercise around 8, 7, let's say 7, and you're exercising for an hour, you actually are going to get a little bit extra energy. So if you want to go to bed at 9 or 10, you might not be able to. So just be mindful about what time works for you for exercise. But number one thing to do is start to exercise. Okay, the next thing is you have to reduce your stimulants. So I'll see people and they'll come and see me in clinic, and I'm going through their history and everything, and I'll ask them, okay, how much coffee are you drinking? And because they're tired, because they're really anxious and they're not sleeping, they're tired and they're drinking like 3 or 4 cups of coffee. And then I'll say to them, what time is your second or third cup of coffee? And they'll say, oh, at 2. And I'm like, oh yeah, no, we need to cut that out. And they're like, but it's at 2. And I'm like, yeah. So I tell people, 1 to 2 max of caffeinated coffee or tea, and nothing after 12 noon, because that will really it will stay with you. You have to remember, those hormones that we talked about, they're circulating, right? They're in your bloodstream, they're circulating. So you've got those hormones, and then on top of that, you add a little caffeine, and it's just more activation. So caffeine is a stimulant, nicotine is a stimulant. Any way that you take it in, nicotine is a stimulant. So if you're chewing tobacco, if you're smoking it, if you're vaping it, any kind of nicotine is definitely a stimulant. And then this gets me to the next point, which is sugar. Sugar is actually a stimulant. And really bad for you. Sugar is actually inflammatory. So remember how we talked about the inflammation? It's going to be the root of all evil. So sugar is inflammatory. So not only is it stimulating, but you get stimulated and then you crash, plus it's inflammatory. So I really recommend for my patients, I tell them, okay, we talk about the amounts of stimulants, so the caffeine. We talk about how their diet is in terms of sugar. And then I also encourage them to eat a really balanced diet. So a clean diet, fruits and vegetables, my family will tell you, that's we must have fruits and vegetables. How much? People are like, how much? I tell people, you've hit it good when 50% of every serving of what you're eating is a fruit or vegetable. Less fruit if you're diabetic, of course, but so 50%. So think about what you had for breakfast. You got it? Is it in your head? Your breakfast? Is your breakfast in your head? Okay. Was 50% of that a fruit or vegetable? No. Okay. Now let's move on to lunch. Think about your lunch. Can you see it? See it? You see your lunch? All right, is that 50% of that fruit or vegetable? Awesome, I see some shaking heads. Yes, a lot of people will reach it in their lunchtime. Good. And then how about last night's dinner? Last night's dinner, got it in your head? 50% of that fruit or vegetable? Yep, good. Some yes, some no. So what you want to try to do is have 50% of the majority of your meals, the majority of your calorie intake be a fruit or vegetable. I tell people you want to try to avoid as much as you can things from a bag or a box. Cans, frozen vegetables are good. Cans, a lot of the nutrients are gone. So balanced diet is really important. Okay, and then well, we don't have those studies. It's interesting. We don't have those studies, and we could talk afterwards. But there's a lot about the sugar industry and how they influenced the early 1960s studies with respect to heart disease. I don't have any data for cancer, but definitely for heart disease. Yeah. Yeah, I'm with your daughter. Yeah, the less sugar, the better. Yep. Okay, so let's move on to the last management technique. So we talked about exercise, we talked about reducing your stimulants, and we talked about diet, and now we'll move on to meditation. Okay, so the first one that I want to talk about is yoga. Has anybody meditated? Anybody here meditated? Oh, nice. Oh, nice. Okay, so yoga. Yoga is an Indian tradition, so I'll give you a little bit of background of where it came from. Yoga is really nice because you get 2 for 1 with yoga. Remember how we talked about the exercise? So yoga will help you to really fulfill that exercise component. There's strengthening there's strengthening parts in the yoga poses. So people who have done that know that there's specific poses with yoga, and you'll transition from one pose to the other. But most of the time you'll hold the pose and you're really focusing on your breath at the same time. So yoga is actually considered a movement meditation, which is really cool. When I do these 6-week groups at Stanford for patients, usually on week 5 or 6, we bring in a yoga instructor. And that's the meditation form, because I want people to be able to experience that. There's also, on most of these, there's data on benefit for anxiety and stress. So yoga is a great form of meditation. The next one is Tai Chi. Anybody done Tai Chi? Yeah, awesome. I see some head shaking. So Tai Chi is a Chinese tradition. It used to be a martial arts, which actually makes sense if you've ever seen anybody doing Tai Chi. It's a beautiful flow of movement, very slow, very intentional flow of movement. And they also have a focus on attention to breath. But really, I've practiced only a few times Tai Chi, and it's really an attention to the movement. It's really just like, where do you stop that movement? So also in elderly, some of the benefits for Tai Chi have been increase in balance and decrease in fall risks. So there's a lot of interest in senior homes to get seniors to practice Tai Chi. Transcendental meditation. It's funny. I talked to my husband about this when I was researching it a little bit more. So it was started in the 1950s and 1960s by the Maharishi yogi, who's pictured here. They use a mantra, and it's and as I tried to find out, they won't tell you what the mantra is, except that. They will say that it's sound that is used to meditate, and it results in a natural transcendence. So the goal of this type of meditation is really sort of it's thought to be somewhat more spiritual, in that you're sort of leaving this present state and you're trying to achieve a higher plane of awareness, sort of like your place in the universe. It's had lots of really famous followers like the Beatles, back in the 60s. And I don't have as much data on that, just in terms of outcomes, but I would say it's definitely something that was very popular in California. There are still in the Bay Area places where you can learn TM for sure. All right. The next one is also a movement meditation, Qigong. This one is a flow of movement. The focus here, it's an ancient Chinese tradition, and the Chinese really believe in the flow of the qi. So the flow of the natural life force. And Qigong is movement to enhance the flow of the qi. So lots of times you'll find places that will teach Tai Chi and Qigong together. And then there's mindfulness. So we'll park here a little bit. Mindfulness is a little bit different from some of these other meditation forms in that it's actually focusing your attention. And I put it on, that's the bottom point, but I really should have put it at the top point. And it's interesting because when I was researching the transcendental meditation, they clearly said they are not mindfulness. Their meditation is not mindfulness because it's not attention focused. There should be no effort. You're just in TM doing the mantra, and that's what gets you to the higher plane. But mindfulness, it's really trying to focus your attention. A lot of people think that meditation is the absence of thought, and it's not. Meditation is really the narrowing of thought, okay? So instead of having all these neural nets firing, and they're just going and going and going, remember that short, that electrical short in the wall that I talked about? That neural network is just firing, firing, firing. What meditation and certainly and mindfulness has one of them, they just try to narrow your thought pattern down and slow it down, just to help regulate it a little bit. So it's one of some of the big points here. It's not a state of, it's a state of being, it's just how am I, not trying to do it. So I'll give you an example. Last year, a year ago, 2 years ago now, I did an 8-week mindfulness training. And so I was really trying to be mindful about meditating. But I finally on the second week went, this is crazy. I'm like making myself more stressed because I'm trying to hit my 45 minutes every day of meditating. And that's when I really realized it's not about doing it. It's just about being present as best you can. And so our instructor said, okay, and it was for physicians. And he said, I know you guys are really busy. He goes, just start with the shower. So I want you to think about this. When you guys are in the shower, how many people are in the shower and they're thinking about what they're going to do, like all the things that they have to do? No, good. Nice. There's some mindful showering going on back there. Good. Yeah. So one of the things that the instructor said to us is use your shower as a cue to you. Leave all the thoughts out and just feel the water. Just use it as 5 or 10 or 15 minutes of a personal spa. Just enjoy that. Don't use it as a time to make a list of what you have to get done. Okay, so be mindful in that shower. It's not the act of doing the shower, it's just to enjoy it. That's what mindfulness focuses on. The thought is that it helps us to understand our relationship to everything else, how we fit in relationship to everything that's going on around us. It's not judgmental, so I said that. So it's not like, oh, that one time I was taking that course, oh, I'm not doing it enough. No, I was already not doing it right. It's not about putting, am I doing it good? How can I do it better? No, it's just about doing, okay? So it's kind of out there, right? It's kind of very, very out there, that definition. But it's really an accepting way to practice just knowing where you are and to try to narrow your thoughts. Okay, there's lots of different types, and actually, as I said, in the 6 weeks that I take my patients through, we meet once a week, and we'll do these different types of meditations. The first one, and for people who have young kids, I really encourage you to use this with your young kids, it's guided imagery. And this is where you will visualize a place. So I started grounding and meditating with our daughter. She was probably 6 or 7. Kids have a wonderful imagination, and if you use a guided imagery, and what I would say to her is, okay, I want you, we would travel and go somewhere, and I'd say, do you remember that place? And she'd say, yeah. I'd go, okay, close your eyes and see it. And then I would say to her, tell me when you're there. And she would, okay, I'm there. Okay, now I want you to see. And I knew where she was going, right? I knew the place. Okay, now I want you to see the trees. Can you see the trees? She'd say yes. Okay, now I want you to hear them. And I would pause, and then I would say, can you hear the trees? And she would say, I can hear them. And then I would say, now I want you to smell it. What do the trees smell like? And I would say, look around you. Can you still see them? I can see them. So that's guided imagery. It's a type of meditation where you pick a place that's enjoyable, the beach, the desert, a forest, and somebody guides you through that meditation. And great for kids. Kids are great at this. The next type of mindfulness is something that's called loving kindness. This is where you bring in a time in the meditation where you felt really supported by somebody who loved you and cared for you, and you recall that thought and that feeling. And then you start sending it out to other people, and you're guided as to who you're going to send it out to. The next one is mindfulness-based stress reduction. This has been around since the late 80s. It was started in Boston. And lots of research, lots and lots and lots and lots of research. This is the type of meditation that made it into the medical field. And this is why I'm able to teach meditation at Stanford, is because these people before me introduced it and found that it was effective. It's an 8-week structured format, and you go straight to meditation every week. There's mindfulness-based cognitive therapy. There are therapists now that are using mindfulness as a way to get people much more focused on a session and to bring up events. And then the last kind that I want to mention is self-compassion. So self-compassion is usually a meditation that I will save for like the 6th week, literally like the last week. It's a hard type of meditation, because the first thing that you have to do is you have to bring in a time that you didn't feel adequate, a time that you felt hurt or vulnerable, kind of like a time where something wasn't going well. And they're not pleasant feelings like the loving kindness. So first you have to bring in this sort of difficult time. And then what you have to do is remember like somebody coming and soothing you through that time. And that feeling of being soothed and comforted is the meditation. So I find that when I've done this, I've had, and we're in a conference room when we do this, and I'll have people sit or stand as they meditate, and some people lay down. I've had, when we end the meditation, had people open their eyes and, they're like, wow, they're not sobbing, but they had tears. So it can be really powerful. So I save that for the end. All right. So what are the benefits? I wish, and it's funny because my husband and I, he'll send me articles about, there's a lot of research going on. I would say that what I've tried to put here is some of the more robust studies. There's a lot of, there are some studies in the Western literature, i.e. the United States, saying, oh, this doesn't work, and why are we spending money, and blah, blah, blah. And I think that a lot of that has to do with the fact that we're not doing really good studies around mindfulness and meditation. So UCSF, my alma mater, is doing some really good studies, and we actually have a group in the pediatric department, pediatric psychiatry, who's doing some really cool studies in the East Palo Alto school district with kids, and they're showing some good results. So it's not just here. Boston, there's good studies in Boston. So the ones that I would say we can park on and be pretty sure is that meditation for sure, and multiple different modalities of meditation have shown a benefit in mood and mood regulation. So when we do clinical scores of anxiety and depression, those have gone down for people who meditate. And it's really cool. You just need to participate in like one of these programs for 4 weeks. There's a dose response curve, meaning it's just like taking a medicine. If I give you 10 milligrams, you get a little bit of an effect. If I give you 20 milligrams, you get a higher effect. If I give you 30, it's even higher. It's the same thing with meditation. And we have always said when there's a dose response curve that there's a physiological effect. It's a real effect. And meditation has a dose response curve in terms of outcomes. It increases life satisfaction and vitality. There's actually a formal score of quality of life. It's really linked to health outcomes. It's a very powerful study, and it's really difficult to budge. Really, really difficult. But meditation studies are finding that they can significantly impact quality of life scores, which is cool, because that means potentially there'll be benefits to health. I talked already about the depression and anxiety. And remember how I talked about thinking? Sometimes when you get into anxiety, it's not just one of these things, it could just be thinking, right? There's less, people who meditate have less rumination and general negative feelings, so their thought pattern is much more positive. So part of what we're thinking is that the meditation causes a change in the neural net, just like the wall analogy, the short circuit analogy. The meditation is sort of fixing that wall, okay, and fixing the electrical circuitry. Remember how I talked about the hippocampal atrophy? They're shrinking in parts of the memory, parts of the brain. Meditation, for long-time meditators, these are people who were meditating for 20 or 30 years. They actually had increased cortical matter in those same hippocampal areas that we saw decreases in people that had been chronically stressed. So they have denser brain regions. Remember how I talked about the immune system going down with chronic stress? We're actually seeing increased immune response in people who regularly meditate, and we're seeing a decrease in inflammatory markers. Remember how I talked about inflammation and how the chronic stress will lead to inflammation? The meditation will counter that. It results in decreased inflammation. And then this is why I personally think that 20 years ago, when we were starting to study this and say, wow, and stress is really bad for you. People are dying sooner, they get more cancer, they're more sick, but we'd say, oh yeah, but it's just stress. And I kept thinking, but why, but why, but why? There are a group of researchers at UCSF who found that there are these terminal ends of DNA called telomeres. They're like bookends. They stabilize that DNA. And what they found is that stress destabilizes that DNA. So just like inflammation is bad, a destabilized DNA strand is really bad. And what they found is that meditation can help the enzyme, help increase the enzyme that stabilizes that terminal end of the DNA. So super, super cool stuff with meditation. I'm not supposed to say that. I'm biased. I'm sorry. Okay. So for the last few minutes, what I'd like to do is, and I appreciate everybody taking notes, so that's awesome, but what I'd like you to do is ask you to just put everything to the side, and what I'd like people to do is to get comfortable, and we're going to just do a breathing meditation. So the way I'd like you to sit is to just uncross your legs, sit nice and even in your chair, and I'll walk you through this. I'm not going to leave you alone here. I'll walk you through it. Feet nice and flat on the floor, if you can. Weight evenly distributed between your two buttock cheeks. And then just let your arms rest. Natural pose is actually they'll just fall on top of your lap. Okay? And when you're in that position, just close your eyes. And I'll start. And what you want to do is just take a nice deep breath in through your nose. 1, 2, 3, and then exhale through your mouth. 2, 3. And we're just going to repeat that. Just try another breath in. And if you're breathing faster, it's okay. Exhale, blow it all out. Another breath in. And then exhale out. Now with this breath, I want you to feel the air coming through your nostrils into the back of the throat, and then exhale. Feel the warm air coming through your mouth as you exhale. On the next breath in, feel the air coming through the nostrils, down the back of your throat, and try to bring it down even further into your lungs, deep, deep, in, and then exhale. Blow it all out. With the next breath in, try to go to a count of 5. In, 1, 2, 3, 4. Keep breathing. 5. And then exhale slow. 2, 3, 4, 5. Keep exhaling if you can. The next breath in. Try to expand your belly. Expand your abdomen with this breath. Don't expand your chest. Try to really just expand your abdomen. Just really let the abdomen expand and then shrink the abdomen. Just really bring your belly button as close as you can to your spine. You can even on the next breath put your hand on your belly and just feel your abdomen expand with that breath and then contract into the spine with the exhalation. Next breath, see if you can expand your hand even further and then contract. Bring your hand as close as you can in. It should make it all the way in, all the way. Keep blowing, keep blowing. And now I want you to draw your breath all the way down. Expand your abdomen and see if you can draw it even past the abdomen into your pelvic region. See if you can visualize your breath making it all the way down into your pelvis. All the way, all the way. Expand it. And then as you exhale, just drop your weight into your pelvis and your abdomen just shrinks back towards your spine. Another breath in. And then with this exhalation, what I want you to try to do is drop your shoulders. So as you exhale, drop your shoulders. Let your shoulders just go. Blow the tension out of your shoulders. Go back to that same breath. You can raise your shoulders on the in-breath if you want a little bit. And now as you exhale, drop your shoulders. Release, blow, 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 and drop your shoulders. Drop, drop, drop. Blow it out. Blow it out, blow it out. And now I want on the inhalation, same movements, but try to count to 8. Slow. 1, 2, 3, 4, 5, 6, 7, 8. And now exhale. 1, 2, 3, 4, 5, 6. Get the end of it. 7. Blow hard. 8. Hand all the way contracted. 9 and 10. Another breath in. And try that again. Expand your breath. Expand your breath. So a deeper, slower breath in. And then a deeper exhalation, slow exhalation out. And now with this next breath, see yourself draw a color in. Draw a color of breath. Pick a color, something that's full of energy and life. Pick a color and see that color as your breath. And then draw it all the way into the abdomen. So fill your nose with that color. Fill your chest with that color. Fill your abdomen with that color. And then as you exhale, exhale black. All the tension, exhale black. Now with this next breath, draw that same color that you've picked, draw it into you, through the nose, through the chest wall, into the abdomen. Feel yourself full of that color, and then exhale, blow the tension out, blow it black, blow all that tension out. And now on the next inhalation, try to draw that color all the way down into your feet. Draw it in through your nose, in through your chest wall, in through the abdomen, and try all the way down into the feet. Can you feel that? See that? See your toes glisten with your color, and as you exhale, there's only a little bit of tension now. Blow. At the end of the breath, you're going to see your color come out. You see it. Make yourself see your color of light come out. Blow, blow. See that color come out. Another big breath in. Fill yourself with that color as deep as you can go down into your feet. And then exhale. And for the next few breaths, we're going to draw the color in, expand the belly, and then with the exhalation, you're going to exhale because you're so full of your light color. You're going to exhale the same color and drop your shoulders. Release the tension. On this next breath, draw the color in, and as you exhale, release the tension now from the shoulders, from the lower back, and even from your feet. Release the tension. Uncurl your toes, let them relax, and just drop. Drop to the ground, and you're blowing out your color. Another big breath in. Try to hold it for 8, 2, 3, 4, 5, 6, 7, 8, and then exhale for 10. Slow. 2, 3, 4, 5, 6, 7, 8. Keep blowing. 9, 10. Another color-filled breath in. And then exhale, slow out. And now I want you to start moving your fingers. Keep with your nice, slow breath. But start wiggling your fingers. Start wiggling your toes. And then with your next exhalation, go ahead and open your eyes. Come back to the room. All right, so how long did people think we meditated for? What do you think? 5 minutes, 20 minutes? 20? 5? 5? Okay. 3. Okay, nice. It was about 12 minutes. Yeah, so you guys were able to meditate for about 12 minutes. How many people thought, oh my gosh, kill me now? No, really? Did some people just like, oh, I can't do this. I can't do this. It's hard. So for people who haven't yet meditated, it's really hard. And once you narrow your attention, you're going to be aware of a lot of things. You're going to be aware of that itch in your back. The feet want to move. I want to wiggle. What am I going to have for dinner? When is she going to quit talking about colors? Right? All these things come in. So when you start meditating, be gentle with yourself and non-judgmental. Don't say I did it good or I didn't do it or I didn't do it very well, or just do it. Just start doing it. And one of the other things that I tell people is it's really good to get into a guided meditation practice when you're first starting out. So when I'm not there right now, my life, I'm not there, but when I'm in a good meditative state, I will turn on a timer with a gong, and it's just quiet for 40 minutes. And I'm just meditating, and I'm just taking myself through it. That's when I'm in a really good spot. But that's not where you could start. So I tell people 5 or 10 minutes with a guided meditation, somebody talking you through it. And why did I pick the breath? Anybody know why I picked the breath? Any ideas on why our breath? Well, we breathe naturally. It's like it's a natural clock. And remember when we talked initially about the effects of adrenaline, noradrenaline, cortisol, and one of the things is it accelerates your breathing, right? So one of the feedbacks to the brain that the body can give to the brain is for the body to say to the brain, hey, I'm going to slow my breathing down. I don't need to be breathing so fast. There's no lion coming after me. So I'm going to slow my breathing down. And that helps to settle the brain down as well. So it's always there. Your breath is always there. That's why when I transitioned us to things that we can do for the stress and anxiety, I said, take a couple of big breaths. So your breath is always there. I try to talk to people about good places to go. I've had people tell me that they are able to take 10 minutes in their supply room closet at work because nobody will go in there for 10 minutes. And they go in there, they close the door, they sit down, and they just will do a 10-minute meditation. It could be your shower, right? Oh, my showers are amazing because I'm just enjoying the shower, not thinking about what I'm going to do, nothing. So it can be those kinds of things, but be gentle with yourself and start slow. But I do encourage you, give it a go. All right. So just to close up, hopefully what I've helped you to understand is stress is essentially anything that really causes us to be off balance. Anything that causes this internal dysregulation that we say, both in the mind, right, because our neural nets are firing wrong, but also in our body. The hormones release, the immune system gets activated, inflammation, the heart rate, our thoughts, all of those things. Stress has an immediate sympathetic and then a slower glucocorticoid response. Stress can reduce immune function. It can increase pathological inflammation. It can increase the risk of mood disorders, and it could definitely interfere with memory and cause even some brain atrophy. And then finally, some of the benefits of meditation is it's showing a decrease in mood disorders like depression and anxiety. It's actually showing that it helps increase our immune responses to things like vaccinations. It's also showing that it decreases inflammation, which is really great. For long-time meditators, it's increasing areas of brain density. And then really exciting, the more recent studies showing that it stabilizes, is probably involved somehow with stabilization of our terminal telomeres of the DNA strands. All right. I'm happy to take any questions. Yeah, please.
So you said when you meditate, your good place is 40 minutes. I know I don't have 40 minutes.
Right.
Is 5 a day?
Absolutely. So we've looked at this, right? And people say, what's the right amount of time? And I tell people, really, there is no really right amount of time. It's more about consistency. But I will say this also. The more regular you meditate, the easier it is to get into your meditative state. So,
I tend to be one of those doer type people. Like
yeah.
I ride my bike and I think about
Yeah.
my breathing.
Yes.
That is far easier for me to do than sit.
Yeah, then for you, things like Tai Chi and yoga and Qigong, those are awesome meditations, right? And really just focus on the movement and your breathing through those movements. Oh yeah, for sure. I had a colleague who was with me, and then she left. She's now at UCSF. She could not sit still, and so she actually rocked. So we would meditate, and she would stand, and she rocked. And her things, there's actually walking meditations too. It's really slow and I found it really hard to do, but there's a lot of difference. So I would say you would want to definitely start there. And then just as you go over time, you're going to notice it's going to be a little bit easier to settle into a meditative state, just a calmer state, right? Just a more focused attention. But I would definitely say start with a movement meditation. Yeah. Anybody else? Okay, the last thing I'll say that I've had people ask me about resources. I was hoping that we had copies of this, but I guess we don't. Maybe what, I'm not sure, maybe I could send this over to the library, yeah? I wanted to just point out a couple. People often will ask me just about sources in the Bay Area. There's a couple that I wanted to point out. I talked about the mindfulness groups that I do at Stanford. I have a colleague who does a mind-body 8-week. You do have to be a registered Stanford patient, so that kind of is a little bit difficult there. But the one that I want people to really take a look at is the Insight Meditation Center. You see that one right there? It's in Redwood City. I love them. They're free. They're a nonprofit. They're free, and they have classes in Spanish as well. So they're really community-based. They're right off, like just a little north of here, actually. Yeah, right off of El Camino, right behind Sequoia, right behind the high school. So they have meditation classes. So if you want to like start to learn to meditate, they're a really good resource. And again, they're free, and they have Spanish classes, which is really difficult to find in other languages. The other programs, the El Camino program and the Palo Alto Medical Foundation, Stanford has this too, has an 8-week mindfulness-based stress reduction. Those tend to run about $300 to $400 for that 8-week series. Sometimes insurances will help cover that. So if you're interested in one of those, you want to check with your insurance. And if your doctor refers you, then that's how they'll help you pay for that. And then the last free links, there's lots of free links, but if you just search UCLA Mindfulness, they have all their meditations are downloadable for free. So UCLA and UC San Diego have mindfulness institutes, and their meditations are online. And that's where you could get a 5-minute meditation there. The other thing is you can YouTube yoga. You can YouTube yoga meditations. There's I've looked at several. You can totally YouTube yoga, and that's also for free. But I would say if you want an audio, if you want a guided, and they're different ones. They're body scan, they're loving kindness. You know, the ones that I had listed, the guided imagery. There's a variety on the UCLA and the UC San Diego mindfulness. If anybody's interested in books, I would really recommend this last one, The Full Catastrophic Living. John Kabat-Zinn is the person who introduced mindfulness that I was talking about into the medical community in Boston. It's a thick book. You can find it like used because there's so many versions, but it really does good summary of what we've talked about in the last hour and a half of stress, and talks about the different mindfulness techniques. There's exercises in there. It essentially is that 8-week course in a book. Okay, well, thank you.
Thank you.